an exercise to understand.
Hello, Professor Dr. Bионди. Nice talking to you. Thank you for coming here. This is your first time in Bulgaria?
Yeah, this is the first time. It's very nice to be here. I have traveled all over Europe, almost all over Europe, not in Bulgaria. It was very nice. I saw very nice places the last 2 days, the night in the center, and it's a really green town. I like much. It seems to be in Italy the same.
Really?
People say this is not differences. I like to stay here.
Okay. What did you enjoy the food? Everyone says the food here is good.
Yeah, we have wonderful, wonderful food. The food maybe is a little bit different because you know that in Italy we love pasta and other things. No, but it's very good. It was very good. With nice places. Very happy to be here.
I want to ask you about your career, but before we go into the dentistry, I know that you have been in another area. Could you talk a bit about that?
Yeah, I was a professional basketball player. I played for 10 years in the professional league in Italy, until in Bologna, in the team of Bologna, and it was a very nice experience. It was very good. Then unfortunately I broke my leg. My career was stopping from that. Then I continued my study. I'm a doctor in medicine because I'm old, and in that period, not dental school in Italy, you must be a doctor in medicine and then making the dental school. So I finished my studies and I started almost immediately studying and doing orthodontics. I was lucky because in the beginning of my career, I met a great professor, Professor Gabak from Michigan University, and I had the opportunity to go in his office and going with him in university, and it was a very good experience, and my life changed direction from the basketball to the chair, dentist chair.
So why exactly orthodontics? How did you choose this particular area of dentistry?
I was a kid because my brother had an office, so was a dentist, and he asked me to do a different thing. And he didn't do any orthodontics, so that's why I started there. Orthodontics is more, you have to think more as like, I don't want to say big things, maybe between an engineer and an architect. Just you have to move, to find a way to make the right movements, and it's really interesting. Really interesting.
What was an interesting story that you would share?
Oh, we have, the story of all doctors is full of persons, patients, persons. So I don't know a particular story now, but I can think to many adult patients. I'm treating most adult patients now in this period of my life. And I saw many patients that were sure that their smiles or their situation was impossible to solve. And we had a very nice results. The most interesting thing is looking their eyes when they finish the treatment. They have a new smile, a new aspect, or sometimes almost not a new face, a new aspect of the face, because sometimes we treat with a surgery, maxillary surgery, and look in their eyes, they're really happy. And that's because we don't think, but many times patients suffer also from small things. Maybe having not a good smile, or are simple things, but some patients suffer on that, and it's nice to help them.
Because we have a lot of students who are just finishing now their dental practice, or who have just finished their dental practice, and they are at the very beginning of their path. So, like, if you could give one important advice to them that you know that would bring results, what would you say?
Yeah, I think that the most important thing is that's must be serious and work with serious people. Try to find the right path from the beginning, not going right and left, changing continuously the ideas, and try to follow the right direction. And not why we are teaching but the basics, but every time you start to do something, you need to know the basics of what you are doing. I show to the students sometimes in the introduction some picture of my career, basketball career, doing some movements, some pick and roll or something different. When I did in the 70s, it's 50 years ago. There's fundamentals. For everything you need to know the fundamentals. You know the fundamentals, and if you know the fundamentals, you can grow. And that's why. Learn first the fundamentals, and then doing more passion to do the different things.
Yeah, it's like the name of your course, like back to basics.
The name is Back to Basics, because now you know that there is fantastic news, and palatal pads and TADs and digital orthodontics and really good materials. But to use that things in the best way, you need to know the basics. And the second name of the course, the under name of the course is Hands and Brain in orthodontics. You need your brain for sure, but you need also hands, because you have to work on patients. So you need to learn how to move your hands connected with your brain.
How do you see the future of orthodontics? Like the near future, maybe the little bit further down the road with all these emerging technologies. What do you see in the future of orthodontics?
Well, that's my friends, most of my friends in the USA, they're quite old now then. And they are not so optimistic on the future of orthodontics, because they are seeing that there's a lot of companies doing directly orthodontics from the company to the patients, but they said, oh, the orthodontist is going to finish, but I think that's not true, because the patients need people that know how to work and serious professionals, and we are not only people working on digital, on the computer, we can do all that in that way. So it's very good. The new technologies are wonderful. The digital orthodontics is extraordinary. That will be a future for the real orthodontists, the people that study the basics and follow the new things, keeping in mind that we are treating patients. We are not only playing on a computer, changing position of the teeth on a computer. So I think that for the traditional orthodontics, it will be for sure a future.
Yeah, sure, because after all, this technology is just a tool that we have to use.
Yeah,
it can't do the work instead of us. We have to use it to.
Yeah. You have to learn not only to use the technologies, but we have to know how things happen, and to know how you have to study, and you have to apply things on the patients in any way. What I said to the students.
Thank you for your time here,
Thank you.
For this interview, of course. And we would love for you to come back here again.
Yeah, thank you.